The goal of this video is to provide information so you can make a fully informed choice at your upcoming appointment to talk about your reproductive health options. There are a number of reasons to consider contraceptive methods. The first and most obvious is pregnancy prevention. Another reason can be to control your period regardless of what type of sex you have, or regardless of whether you have sex at all. Our health service clinicians aim to provide care that is inclusive and respectful of all gender identities, sexual orientations, and sexual behaviors. In this, our clinicians practice our health service mission. We strive to make good health and integrity our students' passion by providing non-judgmental, high-quality medical care and health promotion opportunities that are respectful of culture and background. Our goal is for our students to be empowered by and knowledgeable in making healthy life choices, preventing disease and injury, maintaining chronic illness and disability, and developing effective self-advocacy as they invest in a lifelong pursuit of wellness. If you're curious what methods are safe for you, most women are candidates for most methods. The clinician you will see will review your health history, your family history, to determine any limitations to methods. So for now, keep your options open.
So male internal condom, as well as other barrier method use, is the way to prevent sexually transmitted infection, or STIs. No matter what type of sex you have, with what body part, if it is a mucous membrane, protect it with a barrier. There is a concept called dual method use. This means using barrier method plus another method of contraception. This is the best of both worlds, preventing infection and pregnancy. A full spectrum of complementary barrier methods are available in health service waiting room. We have to pause to talk a bit about STIs. STIs in the US are on the rise, even with pregnancy in young women on the decline. The latest Centers for Disease Control data reports that in 2016, rates of chlamydia increased 4.7%, gonorrhea increased 18.5%, and syphilis increased 17.6% compared to the previous year. Almost 1.6 million reported cases of chlamydia were reported to the CDC last year. That is the highest number of any condition reported to the CDC. For this reason, you'll hear clinicians talk about the value of barrier methods. These numbers are the reason why. The most effective methods of contraception are abstinence and surgical procedures, tubal ligation and vasectomy, that are permanent. Abstinence is extremely safe and effective and absolutely fine to practice. Surgical procedures are typically not recommended for adolescents and young adults because they are so permanent. We can divide other methods into long-acting reversible contraception and short-acting reversible contraception. The key here is reversible. When these methods are stopped, the ability to become pregnant returns.
LARC stands for Long-Acting Reversible Contraception. The World Health Organization recommends LARC as a first-line method for adolescents. LARC includes intrauterine devices, IUDs, and subdermal implants like Nexplanon. Both require referral to gynecologists, which health services can make. Scheduling appointments is easy, and the cost is mostly covered by insurance. The American College of Obstetricians and Gynecologists recommends LARC to be offered to adolescents because LARC is more effective than other methods that can be reversed. LARC is 99% effective and doesn't require remembering to use it to work. For all these reasons, LARC is also likely to be continued once it has been started, and patients who choose LARC tend to be very happy with it. It's true that some providers don't recommend LARC for adolescent women because they're concerned about increased risk of infection or increased risky sexual behavior. This isn't based in practice guidelines, and health services clinicians know this. The World Health Organization affirms the risk of infection with LARC is low and shouldn't impact offering it as a method. There are two main types of IUDs, copper and hormonal. There's only one IUD without hormones available in the US. It's called Paragard and is made of plastic and a small amount of natural, safe copper. Paragard doesn't affect your periods and can work for up to 12 years. There are also a number of hormonal IUDs available in the US, Mirena, Skyla, Liletta, and Kyleena, to name a few. All are made of plastic and release a small amount of the synthetic hormone progestin. IUDs are inserted by a trained healthcare provider. This involves a speculum exam. The IUD is inserted through the opening of your cervix and into your uterus. Some people experience cramps or pain, but medicine can help. Subdermal implants also contain a synthetic progestin, and the most common one is Nexplanon. This method is a matchstick-sized rod that's inserted under the skin of your upper arm. Most people can't see it once it's inserted, but can feel it under the skin. It prevents pregnancy for up to 4 years. The synthetic progestin hormones work by thickening your cervical mucus to keep sperm from reaching the uterus. It also helps prevent your ovaries from releasing the eggs. Depending on what kind you get, hormonal IUDs can last between 3 to 6 years and may make your periods lighter, sometimes to the point that they go away completely.
SARC stands for short-acting reversible contraception. These are methods that don't involve a procedure to start or stop. These include birth control pills, the ring, the patch, and the shot. Some only include the same hormone in LARC, others contain both progestin and estrogen. We'll review them here so you can make an informed choice about what method is best for you. Progestin-only pills are better known as the mini pill. These have no estrogen in them and are often prescribed if you are sensitive to combination pills and having side effects. They release a small amount of progestin every day of the month and don't give you a period during a set week. You have to be very careful to take these pills at the same time daily and not miss them, or the effectiveness drops a lot. The Depo-Provera injection, or the shot, also contains progestin, so it works the same way many pills and LARC work. Depo has to be injected every 3 months to continue working and is about 94% effective.
Combined estrogen and progestin methods are pills, rings, and patches. These methods and hormones work by preventing your ovaries from releasing eggs and thickening your cervical mucus, which helps to block sperm from getting to the egg in the first place. They are all about 91 to 99% effective, depending on how well you use the method. That means the effectiveness of the method is based on your responsibility. A pneumo ring is a small bendable ring that you insert into your vagina. Kind of looks like one of those jelly bracelets from the 80s, but it feels a bit stiffer. You leave it in place for 3 weeks at a time and then take it out for the 4th week. You can expect menstrual bleeding the week you're not wearing the ring. The patch, on the other hand, is a thin beige piece of sticky plastic that releases hormones through your skin. The patch has to be changed weekly, and every 3 weeks you remove the patch and have a patch-free week when you can expect menstrual bleeding. Combination estrogen and progestin pills are the most common method prescribed. They look like this. A monthly combination pill pack usually contains 3 consecutive weeks of hormone-based pills and a week of hormone-free pills. The hormone-free week is when you can expect your period. You have to remember to take the pill daily and know what to do if you're late taking or missing a pill.
That's an overview of all of the methods of contraception. Key things to remember: condoms and barrier methods are the only method that prevents sexually transmitted infection and can be used with LARC and SARC. LARC is the most effective and easiest to use and recommended as first-line options for adolescent women. SARC is easy to start and stop, and the effectiveness is more your responsibility. All of these methods are reversible. If you aren't using a method, fertility is regained quickly. The choice is yours. The clinician you see will review specifics related to your health that may guide your decision. Please bring questions you have to your upcoming visit. Health service clinicians look forward to seeing you soon.